Good afternoon, everyone. This is the Belleville Public Schools 2025 Aetna Open Enrollment presentation. My name is Elizabeth Roldan. I'm here joined with my colleague Brian Atkinson. We are from IMAC Insurance, and IMAC Insurance is the broker for Belleville Public Schools for your medical, prescription, dental, and vision benefits. We are here to help you with any benefit questions that you may have or any claim matters that you would like us to help you with. I know that we've already been communicating with quite a few of you that have either medical claim issues or prescription claim issues that we've been working with you and the carriers to go ahead and get those resolved for you. And we have an entire dedicated team that's available to answer your questions either by calling our office, which is 973-450-9800, or you can send us an email at info@imacagency.com, and we are getting back to everyone usually within the hour. We are making it a big point to make sure that you have all of your questions answered in a very timely basis to ensure that you have all the information you need now during the Aetna open enrollment period, as well as so you're informed about the transition to the state health benefits. Right now, this is your open enrollment period, which began on November 12th, and it is running through December 10th. All of the enrollment changes that you are making now would be for an effective January 1st date. The district is renewing its current Aetna plan just through the month of January. So please know that any changes that you make now, they're going to be effective January 1st, but your Aetna coverages are going to be ending at the end of January because the district is moving to the state health benefits effective February 1st. All of the changes now that you would like to make, you can use the links that Taryn provided in the communication that was emailed out, as well as the links that are on the IMAC benefits portal. You at the district have access to fillable enrollment forms, whether it's for dental, medical, prescription, or vision, that you can go ahead and complete online. And that is sent directly to the Human Resources Office. So we have those links posted on the IMAC benefits portal, but I know that Taryn also emailed them out to everyone. During this open enrollment period for Aetna, you do have the NJ Direct 15 plan. That is the base plan for teachers. If you are part of the other staff, administration, et cetera, that's part of that other collective bargaining unit, you do have Direct 10, but I know that the Direct 15 is the base plan for teachers. And you also have the option to elect from the New Jersey Educators Health Plan, as well as the Garden State Health Plan. The New Jersey Educators Health Plan and the Garden State Health Plan are plans that are the only two options for employees that were hired on or after July 1st of 2020. I see a question here, and I'll answer it because we want to answer these questions in real time. Someone is asking, just to clarify, do you need to fill out all the pages of the document, vision, dental, etc., if you are only switching medical insurance? You do not. You only need to complete the forms and the areas of that you're making changes. So if you are making a change just on your medical, that also impacts your change on prescription because your medical plan choice dictates your prescription choice. But if you're not making a change to dental and or vision, you do not have to complete that. Good question. But as I said, the educators and the Garden State Health Plans are the only two options that are available for employees that were hired on or after July 1st of 2020. As I mentioned, all changes that you are making now under Aetna would be effective January 1st, 2026. And again, the district will be ending its current Aetna plans for on January 31st because it will be transitioning its medical plan to the state health benefits plan effective February 1st. And I see questions coming in, so we are going to be answering them as they come in. On the IMAC benefits portal, we have a full comparison of your currently offered plans, so you can see them side by side. This is just a little screenshot of it, but the full PDF comparison is on the portal right now if you'd like to take a look at it, especially for those of you that are in either Direct 10 or Direct 15 and are considering moving to the Educators or Garden State Health Plan. Someone is asking, if we do not want to make any changes for January, do we just not fill out the paperwork when it's the deadline and pick at the change for February? Yes. If you are not making a change of your Aetna plan currently and you're not adding or removing any dependents, you're happy with the plan that you are in, you do not have to take any action for January. Everyone at the district, however, will be taking will have to take action with regards to the transition to the state health benefits plan. But if you are not making a change for January, you do not need to go ahead and fill out anything. I can tell you that I've been receiving a lot of phone calls from employees that are looking into other plan options because your Aetna benefits, your plans that you're in, if you're in Direct 10 or in Direct 15, there is an increase coming for January. And for those of you in those two plans specifically, your premiums are, your contributions, I should say, are going up 65%. So employees are really taking a hard look now at the educators and the Garden State Health Plan to see if those would be options that would be good for them and their plan needs. Someone is asking how much are the premiums for the educators plan? That is a great segue to this slide. We can tell you that Direct 10 and Direct 15, because of the way that Chapter 78 is calculated at, will always be more expensive than the educators and the Garden State Health Plan. If you look all the way on the left, the Direct 15 and the Direct 10 are all part of what's called Chapter 78. So the coverage tier, so if you're covering family, spouse, 2 adults, parent and child, or single coverage, your salary and the premium of that plan, those 3 amounts are calculated and are factored into the calculation of Chapter 78 for your Direct 10 or Direct 15 plan. So every year that the premium goes up, your plan contribution also goes up. Whereas if you look to the right now with the educators and the Garden State Health Plan, those 2 plans are calculated at what's called Chapter 44. So only the coverage tier, so again, if you're covering single, family, 2 adults, parent, child coverage, and your salary are factored into that calculation. So you will always have a savings in the educators and the Garden State Health Plan because the premium is not factored into that calculation. So it's important to know that unless your coverage tier or your salary changes in the educators plan, you will have a lot of rate stability for that plan, for those 2 plans. To answer the person who was asking about the premiums, for the educators plan, the premium is not factored in, so it's a percentage of your salary. That is part of how you calculate that. And it is a PPO plan. The person was asking that as well. So for example, if you're in the educators plan and you have a salary of $75,000 and you have a family plan, you would be contributing 5.5% of your salary. You would take that annualized amount and then divide it amongst how many pay periods you have. So if you're a teacher, you would be dividing that amongst 20 pay periods, for example. We do have the calculator on the portal. We have a slide on that coming up, but I highly encourage you to utilize the calculator, as all you have to enter into it is who you're covering and your salary, and it'll calculate it for you right away. If you have an issue accessing the calculator, reach out to us. Email us or call us. We will run those numbers for you, as I have been already for members that have reached out. Person is asking, being that I was hired after 2020, my only 2 options are the NJEHP or Garden State, correct? Yes. Everything is driven by your hire date. So because you were hired on or after July 1st of 2020, those are the only 2 plan options for you. But for employees that were hired previous to that, something that I also like to clarify while we're in open enrollment meetings is if you're in Direct 15 now and you leave Direct 15 to go, let's say, to the educators plan, you can always go back during open enrollment. I know there's a bit of a rumor that if you leave Direct 10 or Direct 15, you can never go back, and that's absolutely false. You can always go back because it is based on your date of hire. So as long as you were hired before that July 1st, 2020 deadline, you can always go back to your Direct 10 or your Direct 15. That's why you have open enrollment every year. The person is asking, what is the percentage? The percentage is based on your salary. So this is how the educators plan would be calculated. For the other plans, there is a whole table. And again, depending on whether it's single, parent, child, member and spouse, or family. But to that person who's asking about their specific contributions, reach out to us. We will work with you one-on-one with your specific salary and who you're covering to give you what your contribution amounts would be in your current plan, and if you're looking to move into the educators plan as well. And we are going to be talking about what the plan differences are, so that's a good question. Let me move on. So the Garden State Health Plan also has its own table. As you can see, the percentages are slightly less, but we are going to be discussing why these plans are less expensive, just to make sure that everyone has a full understanding of if they move, let's say, from Direct 15, what happens if they move to the educators plan and how their benefits are different. We also have a contribution savings example that we put together. Again, this is a snapshot. We have the full PDF on the IMAC benefits portal, and I believe this was also emailed out by Taryn. So it's important that you will see that you have a significant savings by moving from Direct 10 or Direct 15 to the educators plan. It's guaranteed significant savings, but now we will get into what the differences are. So for example, the New Jersey Educators Health Plan, they utilize the same network under that plan than they do under Direct 15 as well as Direct 10. So anyone who's in the network now for you under Direct 15, under Direct 10, they're going to be in the network for you under the educators plan. So from that standpoint, there is no difference in your provider network because they utilize the same network. The Garden State Health Plan, however, does utilize a smaller network under Aetna, and it also only has coverage in the state of New Jersey. I can tell you that we see very low enrollment in the Garden State Health Plan because it is a more restrictive plan with coverage only being in the state of New Jersey. So that is something that if you are considering that plan, kind of a red flag, reach out to us. Let's talk about how you currently utilize your plan because that's a potential issue, especially if you have, let's say, dependent children that live outside of the state that, for example, are away at college. The Garden State Health Plan has an issue because there's only coverage in New Jersey, which is why most people that are leaving either Direct 10 or Direct 15, they usually go to the educators plan. As we mentioned, the contributions for the educators plan and the Garden State Health Plan are calculated as a percentage of your salary rather than a percentage of the premium, which is why there is a guaranteed savings by moving into either of those options. Your copay at your primary care is $10. At a specialist, it would be $15. If you go to the emergency room, it would be $125. But again, that would be waived if you're admitted into the hospital. And the two big plan differences between the educators and the Garden State Health Plan compared to Direct 10 and Direct 15 is that your out-of-pocket costs may be higher if you utilize out-of-network providers, and the use of a different formulary or different list of drugs that are covered in the educators plan and in the Garden State Health Plan compared to the Direct 10 or Direct 15. It's important to note that out-of-network and prescription function very differently under the educators and the Garden State Health Plan. So that's part of what we're addressing today to make sure that everyone has a clear understanding of how the plans work and how, based on how you're currently using your Direct 10 and Direct 15, what changes you would see moving into the educators or Garden State Health Plan. As we mentioned, Direct 15 and the educators plan, again, same network for both plans. The Garden State Health Plan, however, does utilize a different network under Aetna. The national network would be the same for both 10 and 15 and the educators plan and 15, but also, again, the Garden State Health Plan, only coverage in the state of New Jersey. Your co-pays for primary and specialist vary depending on the plan that you're in, but they're always going to live in either that $10 or $15 area. And again, your annual well visits are covered in network only with no copay. I see a question in the chat. Person is saying, why don't employees hired after 2020 not eligible for the first two? That is a state law, so that's not even a district rule. That is a state law that was passed in 2020, and that's what's called Chapter 44, that all school districts in the state of New Jersey can only offer the educators and the Garden State Health Plan for employees that were hired on or after July 1st of 2020. So I hope that answers that. And just to continue looking at all the plans compared to one another, none of the plans offer an in-network deductible. Again, your deductible is the amount of money that you would lay out before the plan begins to pay for your claims. You don't have a deductible in-network. Out-of-network, you do have a deductible depending on whether it's for an individual or for a family, and you have different limits there. Your out-of-pocket maximum, which is the most that you would lay out in a calendar year, you have limits in-network and out-of-network. In-network, those would be comprised of any co-pays, of any co-insurances. So for example, Durable medical equipment, private duty nursing, and ambulance, those are covered at 90%. So again, all of those are what contribute towards your in-network maximum out of pocket. Your out-of-network maximum pocket is based on any providers that you're seeing out of network. None of the plans that are offered require a referral. Your labs are still the same across all 4 plans, with LabCorp and Quest being your in-network labs. If you decide to go out of network, you do have your applicable deductible and coinsurance. Same thing applies for outpatient surgery. No charge, covered at 100% in network, but out of network, again, you're subject to your deductible and your applicable coinsurance. Your co-pays for the emergency room are $50 under the Direct 15. They go to $125 under the Educators and the Garden State Health Plan, but under any of the plans that are being offered, they would be waived if you're admitted into the hospital. So we were talking about the out-of-network differences when it comes to the Educators and the Garden State Health Plan. And when you go in network, that means that that doctor has agreed to a certain fee schedule. They cannot bill you anything above a copay. But when you go out of network, that doctor has no contract with Aetna. They can truly bill whatever they like, and anything that is above more than the plan allows is what is known as balance billing. That difference between what the plan allows and what the provider bills, that would be your responsibility as a member to pay that in full. We can tell you that the Educators and the Garden State Health Plan, they utilize a different table out of network to determine what to reimburse those providers, and that table reimburses less than your current Direct 15 and or your Direct 10 table. So it's important to note that if you are considering the Educators plan, and we'll keep on saying it, you're going to save a tremendous amount of money. If you are someone that is going out of network with a high degree of frequency, that's something to consider. If you're going out of network once or twice a year, very likely that what you're going to be paying out of pocket for that provider will be covered by the savings that you're already realizing, because your contributions are going to be reduced. But if you're someone who's going, let's say, on a weekly basis, like I spoke to somebody at another district who also obviously has the Educators plan, they go out of network 3 times a week. In her case, it did not make sense for her to switch to the Educators plan because of her high out-of-network utilization. So that's important to take a look at how you personally, you and or your family, how you utilize your coverages out of network. We use this example as a way to illustrate how out-of-network functions. So for example, under the Educators or the Garden State Health Plan, let's say you go out of network, that doctor bills $100. Aetna will go ahead in this purple box and review what that service, what the allowed, usual, customary, and reasonable amount would be for that service. And let's say they determine that that would be $50. They pay their $35, which is 70% of coinsurance in the blue box. You as the member pay your $15 or 30% of coinsurance in the orange box. That gets applied towards maximum out of pocket. But that other $50 that we haven't even talked about, that is in the red box here. That is what is known as balance billing. You as the member would be responsible to pay this to the provider to make their bill paid in full. And this is what we talk about, that your out-of-pocket costs may be higher by going out of network under the Educators or the Garden State Health Plan. So it's important to know how you are utilizing your plan. Person is asking, are the premiums for the Educators plan more than Direct 10 and 15? No. And to be quite honest with you, from an employee standpoint, the premium of the Educators plan is irrelevant, because you're not contributing a percentage of that premium, you're contributing a percentage of your salary. So where the premium for Direct 10 and 15 is important to note, because you're paying a percentage based on those premiums, for the Educators plan, your premium is based on your salary and coverage tier. So good question there. The other difference when we were talking about the Educators and the Garden State Health Plan is the prescription. So your medical plan choice dictates what your prescription plan is going to be. If you are in Direct 10 or in Direct 15, you have one list of covered medications, you have a set list of copays, and that is a separate plan. If you are moving to the Educators or the Garden State Health Plan, you have a smaller list of covered medications with a mandatory generics requirement, as well as step therapy. What does that mean? So if, for example, I'll use a drug called Crestor. Crestor is a cholesterol medication. It is a brand name medication that under the educators plan and Garden State Health Plan is not covered because it has a lower cost generic option available called rosuvastatin. So rosuvastatin, which is the generic for Crestor, would be covered as a generic, and that would be a $5 copay. There are brands that are covered, and those would be covered at $10. But it is important to do the research now before you make a plan change to see how those drugs would be covered. I've had employees already reaching out asking about GLP-1 drugs such as Ozempic and Wegovy. I can tell you hands down, those are covered at a $10 copay under the educators plan. But definitely reach out to us with whatever medications you and or your family may be on so we can research them for you. It's important to know that before you make a plan change, because at most you're committing for, the month of January, and then you're obviously moving into the state. So it's important to know how come January 1st your medications would be covered should you choose to make a plan change. And I know that please send me those lists, because I know that employees have been sending me long lists. So do not think that, hey, I have 10 medications, that's too much. Send them to me. I had an employee who sent me 23 medications. We looked each and every one of them up to make sure that how they would be covered under the educators plan. So again, important. Person is asking, how are we able to see if our providers take the educators plan? They take the exact same network. So Direct 10, Direct 15, and the educators plan all have the same network of doctors. I do have the instructions on the IMAC benefits portal posted, how you can search for those providers using Aetna's website. But hands down, I can tell you that those three plans, 10, 15, and educators, have the same exact network of doctors. Another question I see here, if I'm enrolled in Direct 10 or 15, would it be more or less than if I choose the educators plan? Yes, significantly more. Direct 10 and 15, from a contribution standpoint, are going to cost employees much more than the educators plan. The educators plan offers a cost savings to employees. This was a plan that was designed with the NJA back in 2020. And the point of the educators plan was to provide contribution relief to employees in school districts. So I personally think it's a great plan. I think it's a very benefit-rich plan, but the plan is not one size fits all, which is why we are making sure that everyone is fully informed and properly educated on how the plan functions, what plan differences are between 10 and 15, to make sure that you're making a decision that not only is going to meet your financial needs, but also meet the medical needs of you and or anyone else you have enrolled in your plan. Person is asking, does the health insurance cover cancer treatment or organ transplant? Yes, all plans do. So please, if that's something that applies to you, please feel free to reach out if you're in the middle of a treatment or anything like that and you have some questions about it. That's what we're here to do, to help out. Person is saying, if there are no generic drugs for the medicine you take, will name brands be covered under the educators plan? That is a bit of an open-ended question. There will always be a drug for every single condition, whether it's a generic or whether it's a brand. For example, Ozempic is a GLP-1 drug for employees that have diabetes. There is no generic for Ozempic. The generic will be out in 2032. But yes, Ozempic, for example, is a brand name that has no generic that is covered. But there are inhalers, for example, that in the world of inhalers for people that have asthma, there are many different options that all treat the same condition. So as I said, there will always be a medicine for every single medical condition, but reach out to us. If you're on certain medication now that you want to see how it will be covered under the educators plan, reach out to us. We are communicating in real time with Benecard to make sure how those drugs would be covered. Okay, so next steps. If you are not making any changes to your enrollment, you are not required to complete any enrollment forms. So if you're right now in the educators plan and you're happy with it and you want to stay in it, great. No action is required on your behalf. If you are someone, however, in Direct 10 or 15 that is looking to save on your contributions and you're looking to make a change to, let's say, the educators plan, you would need to complete the forms that the district has provided links on. Again, we have those links on the IMAC benefits portal. We have those links also. I believe there's like an intranet in the district that employees can access those forms from there as well. Dental is still that 1,000 maximum. Eye insurance is still the same. A person is asking that. No changes to your dental or your vision plan. That's staying the same. We highly encourage everyone to utilize the IMAC benefits portal to evaluate all the plan options. You can compare and contrast them there, and also the contribution information with the calculator that we have posted. And again, this is an open enrollment for your current Aetna plans. You're making an election or a change or staying just for the month of January. The district will be transitioning to the state health benefits program as of February 1st. There is a communication that was sent out that has the information about that upcoming change, and we will be doing a lot of additional webinars as well as on-site visits to make sure that everyone has all the information they need for that transition as well. For this 2025 Aetna open enrollment, any changes or waivers must be done by December 10th. And again, those are completed via the links that are submitted directly to the benefits office, to the human resources office. Person is asking, are we able to get a copy of this webinar? Yes, we are recording it. We are going to be posting it on the IMAC benefits portal tonight. I will be sharing the link with Taryn as well, and she'll be emailing that out district-wide as well, but it will be posted on the portal tonight. Person is saying, would that be different from the current plan? I'm not sure what you're asking would be different from the current plan, so if you could elaborate on that in the chat, that'd be great. Person is saying, if we change to the NJEHP plan now, do we need to do anything in February? Yes. And you're not doing it in February, you're doing it later on in December. So any changes that you make now are only impacting January of 2026. Everyone in the district will have to go into Benefit Solver to elect their medical plan come December 15th. That is when the district will be allowed to go into Benefit Solver, again, per the state health benefits, in order to make those elections. And we mentioned it in the communication, but it doesn't hurt to mention it now. That open enrollment or special transition to the state health benefits, that is happening starting Monday, December 15th, and that will be running through Friday the 26th. So it's important that employees know that that is when that is all happening. We will have additional communications put out, but again, we didn't want to overload everybody because right now the main focus is getting your open enrollment with your Aetna plan completed. Is there a new plan coming? The same 4 plans that you have offered now at the district are the same 4 plans that are in the state health benefits. And we do have comparisons and everything for them on the IMAC benefits portal. When is the due date for change in insurance for February? That's happening beginning December 15th, and employees will have till December 29th, excuse me, to go ahead and make those changes on Benefit Solver. Person is saying, you said the district is transitioning to what? Another health insurance company? Yes. In the communication that was put out by Taryn last week, the open enrollment for Aetna is mentioned in there, as well as the transition or the move to the School Employees Health Insurance Benefits Program, or the SEHBP, or the state as it is known. But yes, that is happening come February 1st, but employees will be making those elections come December 15th for that. As I keep mentioning, the IMAC benefits portal, imacbenefits.com was the website. It's going to ask you for a guest key, and that is BPS, all in caps. So it's important that if you haven't been on there yet, highly encourage you to bookmark that link because everything and anything related to your benefits are posted on there right now, including the contribution calculator, which we have a contribution calculator for your Aetna benefits, for your calculations to determine what your contributions would be in January. And we also have a calculator already posted there for the benefits in the state health benefits effective February 1st. So please make sure that you can utilize them. You have to have Excel 2013 or later in order to utilize them. So if you try and open it with Google Sheets, it will not work, but reach out to us. We will give you your contribution amounts, whether it's for January or whether it's for the plans in the state. To the person that is asking about the state health benefits, yes, everyone in the district is transitioning to that. We do have comparisons on the IMAC benefits portal, and we are going to be hosting a lot of webinars and meetings about that. So We don't want to do that right now because right now the focus is getting through the actual open enrollment for Aetna. We also have the rates posted on the IMAC benefits portal. And again, these are the monthly rates that you're paying a percentage on. So even though we do provide the rate sheet, it's important to note that for your specific contributions, use the calculator or reach out to us. The person is saying, are the premiums going up for the state health benefits? No, they are actually, it's a decrease compared to the current Aetna renewal. So that is why the district is moving to the state health benefits because it provides a cost savings for the district and the employees by moving back into the state versus continuing with Aetna. While this is your annual open enrollment opportunity, we do realize that life happens outside of open enrollment. So just to reiterate, employees do have 30 days to make any changes on their benefits, with the exception of newborns, and that is 60 days, to complete any forms and provide any documentation to the Human Resources Office if you have a qualifying life event during the year outside of open enrollment. Coverage would be then retroactive to the date of the event. But again, your open enrollment is usually in the month of October, in this case, November, and it's with any changes being effective January 1st. For those of you that may have dependent children that are aging out, dependent children age out at the end of the year in which they turn 26. When they are aged out, it is an automatic process, and that dependent has the ability to either elect COBRA. If they meet certain criteria, they may be eligible for what's called Chapter 375, which is a New Jersey state mandate. And if your dependent child is a special needs dependent child, there is coverage continuation for overage dependents with disability. So please reach out to us. I know that we're already working with a couple of employees that some of these are applicable to them. Please reach out to us. We can go ahead and help you through that process. Chapter 375 is a New Jersey state mandate that if your overage dependent child is over the age of 26 but under the age of 31, is unmarried, has no dependents of their own, and either lives in the state or is a full-time student at an accredited public or private university or college, and they are not eligible for any other group or plan or Medicare, they may be eligible to stay on the same plan that you're on for medical and prescription only at a fraction of what COBRA costs. COBRA is 102%. Chapter 375 is about 60.8% of the single premium, so a much more significant savings compared to COBRA. So if that's something that applies to you and you'd like to get more information on it, we do have a link on the IMAC benefits portal, but reach out to us. We have all the information there to help you with that. Someone before at the beginning of the meeting was asking about searching for providers. We have these instructions posted on the portal. Aetna, unfortunately, doesn't make it super simple to find a provider, but we have the instructions where you would pick out the Aetna category of networks and then the actual network, and then you can go ahead and search for providers, hospitals, facilities, anything related to your medical plan. You can do the search on Aetna's website. But again, Direct 10, Direct 15, and the Educators Plan all utilize the same network of doctors. So there's no disruption from that network standpoint. With that said, that really brings us to the end of the presentation. I do see a few more questions here. Person is asking, my primary doctor was not in state health benefits before, but he is with Aetna. Are we switching back to the one before? Yes, in the state health benefits, you will have the option from Aetna and Horizon, as they are both carriers within the state. So you will be able to choose on December 15th when you actually are able to go into Benefit Solver, you'll be able to choose which network you'd like. Benefits, rates are exactly the same. The only difference is the carrier network in the state health benefits. I see someone else is typing a question, but I think the biggest takeaway for today is that, again, the first step in all of this is your Aetna open enrollment. That is happening currently. You have until December 10th to make any benefit changes and or waive benefits or enroll for the first time if you're not enrolled in benefits currently. So please make sure that you go ahead and do that due diligence. Person is asking, what network covers NYC doctors? I go to NYC Lang 1. Both of them, both Horizon and Aetna have national networks that I know this specific hospital very well myself. Both are covered in Direct 10, Direct 15, and the Educators Plan because those three plans have national networks and are covered under both Aetna and Horizon, again, in the state health benefits. I see a couple of, yes, and the person is asking, is it possible to check before choosing? Absolutely. Once we actually get started with your transition into the state health benefits, we will be sharing all of those instructions on how to search for providers. But yes, you will have ample opportunity to go ahead and double check which provider network you would prefer. Person is asking, where do I get the information about the prescription coverage? Benecard puts out a PDF of covered medications and drugs that aren't covered. They put it out every year. They have not yet put out the 2026 one. I only have the 2025 one. I will go ahead and if you put your email address in the chat, I will go ahead and email you that copy and we'll post it on the portal as well. But again, the best thing is probably for you to email us what your medications are because we want to actually send that to Benecard and have them definitively tell us, you know, if a drug is covered or not. I will say that medications and covered drugs are never set in stone. As new drugs come onto the marketplace and are approved for FDA use, any drug that's currently covered in any plan has the potential of being bumped in how it's covered. So that's always important to note that prescription formulary lists are not written in stone. Person is saying, thank you for explaining everything so clearly. I will call the office directly with any additional questions. Thank you. That is what we are here to do. We want to make sure that we connect with as many of you as possible. Everybody's situation is unique and their needs are different. We want to discuss with you how you utilize your benefits, what would make more sense. I actually have been working with one member specifically that she is looking to really move to the educators plan. It's a tremendous savings for her. I'm not even exaggerating. In her case, it is a $17,000 a year savings. She is currently speaking with her doctor because one of her drugs is not covered. She's talking to her doctor to see if there's anything else within that same therapeutic class of drugs that she can go ahead and take. And she really wants to make this work because the savings are significant. I cannot state that enough. But again, it has to make sure that, you know, it works for you, right? That your drugs are covered and all of that. And especially going back to the out-of-network, because I know we tend to focus on prescription. Out-of-network is also equally as important. Looking at how those doctors are covered, that's important. So again, any out-of-network utilization, please talk to us. We'll look into that for you as well. But with that said, that really wraps up today's webinar. We are, like I said, we are going to be posting this tonight on the IMAC Benefits portal. We will be meeting in person on Tuesday, December 9th at the high school auditorium. I look forward to connecting with all of you in person because that meeting is really to discuss the transition into the state health benefits, which I know is important for everyone at the district, as it will require everyone at the district to take action on Benefit Solver with regards to that transition. Person is asking, is the deduction for medical insurance pre-tax or post-tax in your paycheck? It is a pre-tax deduction. Your medical insurance premiums are pre-taxed. So yeah, I hope that answers that. Perfect. But again, feel free to reach out to us. We're here to help you with any questions. Person is asking, do we have a health savings account? I don't believe the district has this, definitely not as part of any of the medical plans, but there is flexible spending. That you can certainly reach out to Taryn in the Human Resources Office to get more information about that enrollment, but I hope that answers that question. Thank you so much, everyone. I appreciate everyone's time today. And again, please feel free to reach out to us. We are here to help you and make sure that you have all the answers that you need regarding your health insurance. Have a great rest of your day.